Welcome everybody to Healthy Talks, and welcome back to one of our first episodes. Today we have Steve Curtin. Yeah, Steve has a big name in the industry. He joined the Gypsy Nurse after a decade in executive level marketing roles for national staffing firms. Prior to that, he was the co-founder and vice president of marketing, content, and partnerships for nursetogether.com, one of the original and most successful online communities for nurses. He's a Boston native and a massive sports fan. He enjoys spending time with his wife and 4 children. Steve, welcome to the podcast.
Thank you, Julian. Nice to be here. Thank you for inviting me.
Absolutely. Very happy to have you here. So let's get started with the first question. Steve, your journey into the Gypsy Nurse followed a decade in executive level marketing roles and co-founding nursetogether.com. What drew you to the travel nursing community in the first place, and how has this background influenced your approach to leading the Gypsy Nurse?
Well, yeah, so my first entry into healthcare and healthcare travel started with an organization called nursetogether.com. It was one of the first online communities for nurses and healthcare professionals. So that was really where it got started for me, and my interest level really continued within healthcare and certainly the travel healthcare community. After that organization, we were acquired by a private equity firm and eventually became involved with a healthcare staffing firm. That really started me on my journey. And then back in 2017, I became involved with the Gypsy Nurse, which was an online resource and support community for healthcare travelers and travel nurses. So it really started with Nurse Together and kind of continued through staffing into the Gypsy Nurse.
Fantastic. And then the Gypsy Nurse itself, you've said, has evolved from just a simple blog into now the #1 most recognized brand in travel nursing itself, which is quite something. I mean, can you share the key factors that contributed to that and what you believe sets the Gypsy Nurse apart in all of this?
Yes, it's been quite a few years for the Gypsy Nurse over the last few years. We've thankfully experienced tremendous growth. And I really think it comes down to the core of what we're trying to do. So at the Gypsy Nurse, we are really all about healthcare travelers and travel nurses. We're designed to support them at all aspects of their journey within nursing. So it could be somebody that is just starting out in travel nursing or travel healthcare. It could be somebody that is interested in travel nursing or travel healthcare. It could be somebody that needs support and resources during the middle of their career, or perhaps somebody that wants to transition from staff into travel nursing, right through people that are, at the towards the end of their career, maybe looking for alternative healthcare travel assignments that perhaps take them off the floor or take them off, direct patient care. But I think what makes it work so well, and the reason why we've had such growth, is the fact that the community knows that we are there to support them. We do everything from live events. We have fantastic knowledge base articles on every aspect of healthcare travel you could imagine, from taxes to how to get started. We have a complete travel nurse guide that gives you step-by-step instructions on your journey. We have employment opportunities, so we work with a variety of different agency sponsors that post their jobs there. We have a lot of partnerships to provide value to our community, such as a partnership with Furnish Finder, which is the largest basically housing, fully furnished temporary housing organization in the country that helps nurses, try and find different locations to live while they're on assignment. So it's really just about centering on the travel nurse, centering on the healthcare traveler, and trying to provide them with information that will support them on their journey. So the Gypsy Nurse actually started many years ago by a travel nurse. She had fantastic information on traveling and how to travel, and then subsequently wanted to provide that information to the community to help people on their journey. So she had done a blog and then eventually a simple website, And I became involved in 2017, and we expanded the offerings, expanded the site. But really, I think her vision remains today, which is supporting the healthcare travelers, which is what we're all about. Another aspect of our growth is the fact that we have joined forces with TravCon, the Healthcare Travelers Conference. It's the largest in-person gathering of healthcare travelers in the country. It takes place every year in Las Vegas. So this coming September in 2024, we will be putting together another TravCon. It's attended by thousands of healthcare travelers and exhibitors. But again, the core aspect of TravCon is supporting the healthcare traveler. So I think we've stayed true to our mission in supporting healthcare travelers in their journey, and that's one of the things that's really helped us grow.
Sounds like a very complete service. And I think the implicit trust that you've built within your organization has clearly sent you to new heights. I don't think there's anything that you haven't overturned just to see whether you could make any little improvements to the service that have really taken off. I know you might have mentioned them right now, but just specifically, what changes and enhancements have you introduced to further support and empower the travel nursing community? You did mention things like TravCon and a few other partnerships, but could you just go over some of those again, just so that everybody knows exactly what you've done in order to grow the company?
Sure. Really, starting in 2019, we took what was frankly a very simple blog-based website and completely overhauled it, because obviously the support that we provide is based on the ability to access the information, remotely, whether it is off your phone or off your laptop. But we are the Gypsy Nurse is essentially a virtual community. So given that, we completely revamped our website, thegypsynurse.com, and we added a tremendous amount of content and functionality to the site. So we made it mobile friendly. We added a new job board component. We started introducing live and recorded events. The other aspect that we did, quite frankly, is putting together a wonderful team, and I'm very fortunate to work with some very dedicated professionals that, again, put the healthcare traveler and the travel nurse at the center of everything they do. So we added some very talented folks to the team in a content aspect, in a community and social aspect, and also too from a sales and sales support aspect. One of the things that makes us work, and one of the reasons that we're able to expand and support the nursing community, is due to the fact that we've got a number of wonderful sponsors. Many of them are healthcare staffing firms that are trying to reach out to travelers for obviously potential employment. So we revamped our sales team and our sales support team so that we're able to bring in more agency sponsors and more clients in that regard, and that allows us to put the funding and resources back into improving the site. Currently today, Julian, across all of our platforms and registered members of our website, we have almost 650,000 followers. So this would include registered members of our website. It would include folks in our Facebook platform, Instagram platform, LinkedIn, etc. So we have tremendous reach across all those platforms, and we put a lot of resources and time and effort into supporting folks on those platforms so that the groups are run correctly, they're moderated correctly, and we're providing people with great information. And then again, as mentioned, with the addition of TravCon, we now have the best of both worlds. So we have a tremendous online and virtual community that is supplemented by the largest gathering of healthcare travel professionals in the world. So it's wonderful. Each year at TravCon, we get a chance to meet many of the people that are on the Gypsy Nurse platform. We get a chance to meet them in person, and that's just it's fantastic. There's really nothing like it.
That sounds like you have quite the team, Steve.
We do.
You guys have put into, you guys, as I said, it really seems like no stone has been left unturned. It's a very thorough job you guys have done, turning something what may have seemed like a very simple resource, but effective resource into a very profitable and useful business to so many people, and resource rather. So just coming back to TravCon, because I know it is a big part of now what you guys do. What's about TravCon? What is the significance? How does it contribute to the professional development and well-being of these travel nurses?
Yeah, no, great question. And we always, within our team talk about the value of TravCon, what it brings, and how we can improve that value to the healthcare travelers. We say really there's three components to TravCon that make it work. Number one is the educational component. So it is essentially a 4-day gathering of travelers, and education is number one. So last year, as an example, we had over 70 different speaking sessions, if you will, or educational sessions with over 50 speakers. And many of these events or many of these sessions, travelers have the ability to earn CE units or continuing education units, which in the United States are critical to their and necessary for their professional accreditation. So we offer a wide variety of educational events delivered by expert speakers in which the travelers that attend will be able to get continuing education credits for them. In addition to that, there's also a lot of general information sessions. As I said, in the States, healthcare travel, there's essentially a tax component to it. The taxes can be quite complicated. So we have tax experts speak to travelers about the best, best ways to complete their taxes or best practices and what have you. We have sessions on how to travel with family members, how to travel with pets, we have medical Spanish sessions. So for people that need to treat Spanish-speaking patients, how best to do that. So we really offer a wide variety of educational opportunities for the travelers. So that's number one. Number two is the connection between the exhibitors and the travelers. So last year was our largest TravCon ever, and we had over 140 unique exhibitors in a massive exhibit hall. And it gives the agencies and some of the related firms an opportunity to meet with travelers directly, network, interact. It's interesting, many of these firms, TravCon has been around, I believe, close to 14 or 15 years. And many of these travelers have an opportunity not only to meet people that they've traveled with in the past and made friends with on the road, but also to get an opportunity to meet the agencies and recruiters that they've been working with over the years. Because much of that stuff is all done remotely, so it's an opportunity for the agencies and the travelers to get together, to network, to celebrate each other, and so forth. And it's also a way to make new connections and meet new employment opportunities with different agencies and evaluate them. The third component, honestly, is fun. It is an opportunity for the travelers to get together and the agencies to get together, celebrate each other, and really enjoy Las Vegas, which is a wonderful place for fun. And so we have a lot of receptions. We have an after party the night before we wrap up at a nightclub on the Las Vegas Strip, and it's fun. It's celebratory. As you well know, healthcare and healthcare travel, the clinical, the practitioner side is incredibly stressful, incredibly demanding. And it's always been our thought that this community needs to be celebrated. They need an opportunity to, enjoy themselves in a stress-free environment, and we like to provide that. So that's really why TravCon has worked so well over the years. It's those three pieces that really put on a platform that make it entirely different than anything else. The venue is great. It's at the Paris Hotel in Las Vegas. So it's a wonderful facility, great food. There's lots to do. Obviously, Vegas, you have shows and events. And you have a lot of sponsor gatherings through what we do as well as what the agencies have. So it's really just a fantastic, well-rounded event. It's really quite unlike anything in the healthcare industry.
Wow, that sounds like again, everything was very well thought out. When did that partnership start, just as an added additional?
Yeah, so the the Healthcare Traveler Conference, or TravCon, became part of the Gypsy Nurse in early 2022. So interestingly enough, as I had been in healthcare and healthcare staffing and online healthcare communities for a number of years, I in fact had never attended TravCon. So TravCon 22 was my first TravCon, and it really exceeded all expectations. I can't emphasize enough. Unless you're there, you really can't have an appreciation for it. It became under the Gypsy Nurse umbrella, if you will, as a separate operating entity in 2022. We had our second show just this past September. And it was another record breaker with record-breaking attendance, record-breaking number of exhibitors and exhibit hall space. So it just essentially continues to grow. So TravCon had existed for many years before that, but in terms of being part of the Gypsy Nurse, it all came together in 2022.
Fantastic. Another thing we briefly spoke about on the initial meeting was the study on the voice of travel nursing, and it brought very insightful revelations, if you will. What inspired the study? Could you share some of the key findings that shed light on the needs and concerns of travel nurses, particularly in relation to patient care?
Sure. Yeah, it's one of the benefits or advantages that we have being such a large community is we touch so many healthcare travelers and travel nurses. We have, just the ability to tap into that wonderful community for information. And in this particular instance, one of the things that struck us back in 2022 was the fact that nobody, to our knowledge, had really done an in-depth study or inquiry into the attitudes and beliefs and satisfaction levels of travel nurses. So there have been a lot of studies around nursing, but nothing specific to travel nursing. So knowing that there are different components to travel nursing, and with that thought in mind, we engaged a independent market research firm to work with us to see if we could delve into and document and quantify the attitudes and beliefs of travel nurses at that time. Now, if you recall, in the spring of 22, we were just kind of coming out of the COVID pandemic here in the US. And we frankly had some predisposed notions as to their thoughts and beliefs at that time, the thoughts and beliefs of travel nurses. But the study actually did present us with some surprises. I'll share a couple of highlights. And again, I would encourage anybody that's interested, they should go on the website, thegypsynurse.com, and download the Voice of the Travel Nurse study. It's free for anybody to take a look at. But we looked at it from a couple of different perspectives. What were their attitudes towards nursing? What were their attitudes towards travel nursing? What were their attitudes towards facilities? And what were their attitudes towards agencies? Because it was travel nurse focused, it wanted to delve into the relationships between agencies and travel nurses. And here's a couple of things that we found. Number one, I think there was a popular belief that pay is number one for travel nurses or healthcare travelers. A lot of the other things, the thought was that they come in a distant second in terms of location and some of these other factors when it comes to travel nursing. That was clearly not the case. While pay was certainly important, there were other things that were just as important in many respects to travelers for their satisfaction. The aspect of how comfortable they were working with the agency, how the hospitals were treating them, how the onboarding process was, how the other staff members were treating them. So it was really interesting to see that, well, certainly pay is an important factor. It is not the driving or the sole factor behind travel nursing. The second item was that while certainly there are problems within just healthcare clinicians right now, the U.S. system is certainly under a lot of stress. Nurse to patient ratios and those sorts of things, underfunding within the facilities. There's a lot of stress there, and that was certainly exacerbated during the pandemic. But we found that while there was some general I guess, dissatisfaction within nursing overall, travel nurses, those that traveled, looked at travel nursing as an oasis within the nursing environment. So in other words, despite all the turmoil that was going around in nursing, and frankly still continues to this day, people that chose a travel nursing path were very, very happy to be a travel nurse, because in many respects, I don't want to say removed them from some of these problems, but gave them a different perspective on some of these problems. So they, as a traveler, they had the opportunity to move away from hospital politics. I think in every business organization, there's always some political turmoil, if you will. This gave them the ability to move away from that. They felt like they could make a difference. So when they went from place to place, they really felt like that they were making a difference, not only for the patients but also for the nurses that they serve with. They liked the aspect of meeting new people and seeing different different geographies across the U.S. So despite everything that was going on, there were a lot of aspects specific to travel that they loved and wanted to continue travel nursing, despite what we thought maybe there would be a tendency to get out of travel in general. They wanted to stay within travel nursing. So it was really interesting how travel proved to be a refuge or an oasis from some of the turmoil within staff nursing, if you will. The other two things that we found were just the importance of the agency traveler dynamic. And some of this just comes down to basic best practices when it comes to business relationships, because there is a component of this that is a business relationship. Agencies need to communicate with their nurses on a regular basis. They need to respect them and make them feel wanted. There needs to be transparency. Again, frequent communication. So all of those things that would be part of kind of a normal business relationship, it's doubly important when it comes to the traveler and to the agency. So that dynamic of communication and connection and engagement and respect is really, really important. And lastly, when it comes to the facilities, it's a similar type of thing in that better outcomes happen in staffing engagements when the facilities are also supporting the travelers. So specifically, including the travelers in organizational events, in meetings, communicating with them, having the staff embrace them, having a smooth onboarding process, giving them the tools that they need, communication on a regular basis. All of those things are really important for the travelers. And when you do those things, there's going to be better outcomes. It's going to be a better assignment. And again, going back to the agencies, when they do the right things, they're going to have frankly a traveler for many years to come. If you do the right things, the travelers will want to work with you again. So there was a lot of information there that I unpacked, Julian, on that report, but I would encourage anybody to go take a look at it. You can use the data as long as you cite the Gypsy Nurse as the source, but we're very proud of that study. We think it provides some tremendous insights into healthcare travel that continue today.
Again, a very thorough job. Thank you for explaining it and giving us some of the most crucial insights. I think it's very important for organizations such as yours to really pay attention to the people that they are serving or servicing, rather. I think it's an unfortunate disconnect that many companies, especially in the medical industry, have, and hence you have a lot of the problems that you just stated. And it really shows that you are an organization that truly care about the people you're working with and actually ultimately aim to serve them. So thank you for doing such a great job, and thank you for doing such wonderful work. I think they really appreciate it. And I think if anybody hasn't gone to check out the Gypsy Nurse, and there are traveling nurses within the US, go and check them out. And even if you're not in the US, they've got some amazing stuff. So with the demand for travel nurses surpassing the supply, how does the Gypsy Nurse play a role in helping nurses navigate through these challenges? And what advice do you have for any nurses considering travel nursing as a rewarding career path?
Sure. Well, it's a great question. I think that what we do are a couple of things. Number one, at the end of the day, we're about supporting the healthcare traveler and the travel nurse. We are literally there to serve them. All of the information on our site is free. So it's really about serving them and providing them with the information that they need on their journey. I think one of the ways that we essentially help the industry, if you will, is that if folks have the information that they need, if they're educated on what healthcare travel and travel nursing is all about, if they understand tax implications and how to get started and how to negotiate contracts and all of those sorts of things that go into this engagement, they're more likely to stay in the industry. So I think, as they always say, education is power, right? Knowledge is power. So I think that by empowering the travelers with this information, they are more likely to stay in the industry and be part of the healthcare travel community. I think the second component is, healthcare travel. It is essentially a vertical or niche within uh, the healthcare community in general. So there may be people that are interested in travel or travel nursing. We provide that information. So how to get started. So obviously it's a decision entirely to them. It's quite different than being on a staff, but it is an option that many providers and clinicians may not have thought of. So we provide them with that information to, evaluate that option and see if it's right for them. So I think not only do we help people stay within the healthcare travel community, but we also provide information that might get them into healthcare travel. Another important point, and I should have mentioned this earlier, a lot of the information that we provide too is on mental health. Obviously, healthcare can be a very straining profession, and I think more and more, and rightly so, mental health issues are coming to the forefront, not only in society but also too, particularly within healthcare providers. So we provide a lot of information for mental health and mental health resources, and hopefully too that helps support the travelers and helps them to feel better about what they're doing and provides them with a better level of support. Excuse me.
Don't worry, when my mic was shut off there, I had a bit of a cough myself. Don't stress. So the Gypsy Nurse actually boasts about 60,000 registered nurses. I imagine that's in the plus, not the minus. How does this community foster collaboration and support among its members? And in what ways do you envision the community evolving to be better to serve the needs of travel nurses in the future?
Yeah, so we have for the gypsynurse.com, we have over 60,000 registered members of our website, and registered members of gypsynurse.com get special benefits. So if anybody is interested, you go to the Gypsy Nurse. It's a very simple registration process, and there is information that's not necessarily available to the general public, if you will. We have great partnerships that they can take advantage of, discounts on things like CEs and even rental cars. So there are 60,000 registered members of the website, and our platform, which would include all of our social areas, things like we have a gigantic Facebook network discussion group, which is essentially an open discussion on all things travel nursing. We have a housing group, a jobs group. Again, we've LinkedIn, Instagram. Our entire platform, we have over 600,000 followers and members. So what that does, Julian, is it provides essentially a critical mass of information and support for the community. We provide them with a unique opportunity in a safe environment to communicate, provide each other with information, advice, support. As an example, the Gypsy Nurse Facebook network discussion group, which is a private group, but if people are interested in joining, they just go in, fill out a quick form, and we'll check it out and approve it. But in that particular group, with again over 180,000 active members, there is all sorts of discussion and information there. Everything from, I am traveling to Oklahoma. Does anybody have any recommendations on, places to stay? And it might even be through, information on, how to connect with other travelers, how not to feel lonely. So it's really this gathering of information.
Wonderful. So yet another just tool and forum for everybody to get some sort of insider news from the community that makes you guys what you are, I suppose, in a way. I mean, and as the voice of travel nursing, essentially, especially in the US, how do you envision the future of travel nursing, and what role do you believe travel nurses will play in shaping the future landscape of healthcare delivery? Where do you see that going in the next couple of years?
Well, travel nursing has been around for many years as a profession. I feel it's going to continue as a profession and a wonderful option for people. There is, unfortunately, we just simply don't have enough nurses in the travel community. Or certainly enough nurses in the community in general. So I think there's always going to be a need for travelers. I think that needs going to continue to grow, and I think it provides a great option for people. And again, it's the type of thing where people they may start out in staff, and then at some point in their career decide to go to travel. They may travel for a while and then decide to go back to staff. So a lot of times it can be, people can be in and out when it comes to healthcare travel. But I think at the end of the day, the need for healthcare travelers, including nurses, and this goes into the allied area, PTs, OTs, respiratory therapists, all those sorts of things. The need is just going to continue to grow. I think it's a great career option for people. So, my sense, it's going to, if anything, it's going to grow. We have, here in the U.S., we have an aging population, longer lifespans, so the need for healthcare practitioners and clinicians and so forth is only going to continue to grow. So I think for travel nursing and travel healthcare, it's just it's going to continue to be an opportunity for people in healthcare.
I think especially for those who are looking for something a bit different, with the current constraints of regular nursing, if you can call it that, although it is a very taxing industry. I think you guys provide a fantastic outlet of education and pretty much all resources that one would need in order to truly fulfill their travel nursing requirements. I mean, do you have any examples of people almost like the word escapes me, but examples of successes that you would know of particular nurses who have mentioned you guys and said, testimonial. There we go. My word came back to me. Have you got any particular testimonials that you can mention that would kind of give us an example of what that's like?
Sure. I mean, thankfully we've got lots of testimonials, some of them documented and some of them just that we've kind of saved, over the years personally. But there are several testimonials on our website actually that in the footers of our website that we use. But I think generally speaking, and I think some of the best testimonials come ironically from people that I've met in person at TravCon. So we have a lot of nice communication coming in through emails and our network discussion groups and so forth. But really, some of the more lasting things that have come in have been through meeting people in person. And when you meet them at TravCon, and we have a booth at TravCon specifically for the Gypsy nurse, pardon me, that people come right over to us, their eyes light up, and they will thank us for the information that we provide. They'll talk about how much they learned. They'll say that they got into travel nursing, several years ago because of the information provided in the Gypsy Nurse. So it's really just this, this aspect that we're there to support them, that they appreciate the information, they appreciate us and what we do. I think that's what's most rewarding. So I think there's it's whether it's written testimonials, and that's great, but it's really with TravCon, it's been the opportunity to meet some of them and actually speak to them and have them tell us how much they appreciate the information support we provide. That's what's most meaningful for me.
Wow. Yeah, well, I suppose you guys do such important work, and you guys have such a huge following. It must be fantastic when people genuinely take the time out of their day to just say, "Hey, listen, you absolutely improved my my career life, and you taught me something that I wouldn't have otherwise known," and it's fantastic. So in closing, how can the insights and initiatives from the Gypsy Nurse contribute to an overall improvement in patient care? And, what message would you like to convey to healthcare professionals about the importance of fostering a supportive and rewarding environment for travel nurses?
Yeah, a great question. Excuse me. And I think that some of this I would relate back to the voice of the travel nurse study that we did, as well as what we kind of glean from our interactions over the years. Again, I've been involved with the Gypsy Nurse since 2017, and I think that the one thing that keeps coming back at me is you have the traveler, you have the facility, and you have the agency. But what makes it all work really is while it is a business transaction, so when you are traveling, there is a business component to it for sure. However, it is getting back to the communication and the engagement, and really, frankly, treating people the way that they want to be treated, and supporting people. So while it is a business transaction between the traveler and the agency and the facility that they may be working at, everybody needs to uh, make sure that they're communicating clearly with each other. It's that respect factor. It's really about relationships and forming a relationship that works for everybody. I think at the end of the day, that's what makes the most impact. People need to communicate. They need to be transparent. They need to be genuine and have genuine communication. And in particular for the agencies and the travelers, I think that there needs to be a focus that it is a people business. And when you have these sorts of relationships, you need to make sure that you're making that connection, that there is a mutual respect, there's mutual transparency. And I think the whole equation just works better when there's improved communication.
Thank you very much, Steve, for all your insights. Thank you for taking the time out to share not only your story, but the story of your organization, what it means to people, how it's helped so many, how it continues to grow and help more people that may choose to do this profession for a variety of reasons. But for whatever reason you choose to do it, you can be sure that Steve and the team have got it covered. Thank you, Steve, again, just for taking the time out. We will have a link for the site down below. Please be sure to like and subscribe this podcast. You can also find it over on Spotify. And yes, this has been one of the first episodes of Healthy Talks. Steve, thank you very much for coming on.
Julian, thank you for having me. It was a pleasure.